kind of a evolving situation. So first of all, I'm going to give you kind of the ground rules for the media conference. So we're going to talk about who will speak and in what order, and we'll answer questions after our speakers speak. We'll answer questions for about 10, 15 minutes, okay? And then we will definitely not answer questions that are speculative in nature, that have any personally identifiable information. We want to ensure patient confidentiality, and we ask you to respect people's privacy and their families' privacy. That's very important helps us do our work as we seek to really protect and improve the health of people in Pierce County. So that is a very important request of you to honor people's privacy and allow us to focus on providing you with relevant and accurate information. Okay? So our speakers today, Dr. Anthony Chen, he is the Director of Health, Tacoma Pierce County Health Department. We also have County Executive Bruce Meyer, and then taking questions afterwards are both Executive Meyer and Dr. Anthony Chen, as well as Nigel Turner, who is our Communicable Disease Division Manager and the Incident Commander currently. So I will introduce Dr. Anthony Chen.
Thank you, Edie. Thank you all for being here. I'm Dr. Anthony Chen. I'm Director of Health at the Tacoma Pierce County Health Department. As you are probably aware, we have been working in Incident Command now since January 24th, since the case in Snohomish. And I just want to do a call out to my staff. We have more than 60 staff who have been working hard on this incident. Also want to thank the executive and Pierce County and staff from the emergency management for helping us in this response. You will hear later from some of our other staff who've been activated for this, but what I would like to announce today is that we have our first COVID-19 case in Pierce County. This is a gentleman in his 50s with underlying health conditions. He's in stable condition at St. Anthony's Hospital in Gig Harbor. What we can share with you at this point is that he went to the hospital on March 4th. He was found to have pneumonia, but tests for flu were negative. The hospital ordered the test for COVID-19, and it is presumptively positive. But just to be aware, of course, is that this needs still to be confirmed by the state lab. So the little nuance there is that this lab test was run at the University of Washington. We are very excited that the University of Washington Virology Lab is now online. We understand there have been a lot of frustrations about getting tests done. This is definitely will help us with our capacity. So we are at this point working to identify contacts of this patient, and because that's what public health does, right? I mean, we might not have any magic bullets, we might not have a vaccine yet, but public health, we're going to get out there, we're going to find out who this person may have been in touch with, who may be at risk for the infection. We want to know where he's been, where he might have acquired this infection, and then we're going to be working with the community and other people who might have been exposed to make sure they get the care they need. We do expect that this is only the first of other cases. I think we all knew that at some point this would move down from King County and Snohomish County. However, we've been prepared for this. Both we and all our partners have been planning. And fortunately, the public doesn't have to see us plan because it's not always very exciting. However, I think the community should be reassured that we have been planning. It's not just us, it certainly has been our partners at Department of Emergency Management, has been the schools, has been the hospitals, many other people in the community, and of course the cities and towns here in Pierce County have been planning as well. So I am glad to say that this patient is stable and improving, so we're certainly very concerned for him and wish for a speedy recovery. We're still learning as I said, where he might have been, what might have been risk factors. And of course, we want him to focus on recovering while we do the work and work with other people in the community to see what we need to do. I do want to mention that, unfortunately, in this age, not only is there information, there's a lot of misinformation. We know there have been hoaxes and other things. We just want people to recognize that here in Pierce County, if they want to look for confirmation that there has been any positive tests, it will come from the health department. The health department in our county, we are the only ones who can confirm a positive case of COVID-19. And similarly, in other counties, it will be the local health jurisdiction who will be the authority on that. So, of course, part of our role is to make sure that the public has the right information, and that we are the reliable source of that information, and that we're sharing information with our partners so that they can get the right information and people can make the right decisions and do the right things for their health. So public health, we do have a playbook. It might be an old playbook that has gone back for centuries, but it is a playbook that we know works. As I said, when there is no cure, when there is no vaccine, public health knows what to do. And we have seen this, overseas in Africa. You have seen recently that they just discharged the last patient with Ebola from the second worst Ebola outbreak. And there are no magic bullets there other than public health working with the healthcare partners to make sure that people got better. And again, we cannot do this unless we have partnership, and I'm very grateful that the Executive Dan Meyer, as well as other leaders in the community, have offered resources, have been just great partners with us in this, and they're working to amplify messages. I think the most common question I get asked from our partners, whether they're schools or elected officials, is what should we be doing at this time? And I want to put this in context for people. So, we always give Seattle and King County a hard time, right? So there are some times when it's good to be laggards or behind, and we have learned from what has happened in King County and Snohomish County. We've learned from what's happening in Italy and other parts of the world, and certainly, of course, we have learned from what has happened in China. We know that the infectivity of this virus is probably similar to influenza. We know that 80% of people are going to do just fine. They're going to recover. And we know the fatality of it is probably as, similar to a bad flu season. So what's that mean? As you are making decisions about what you want to do or need to do, think about what would you do if it were flu season. Actually, we are still in flu season. So think about what you would normally do. And of course, you all know what I'm going to say. Wash your hands, cover your cough, stay home when you're sick, don't touch your nose and mouth in other places. But of course, if you have a chronic health condition, if you're over 60, I'm sorry, I was just talking to a mayor and he said, wow, over 60, that's like most of my city council. And but we had to draw a line somewhere. We're saying over 60, we don't want to say elderly. But there are certain risk factors we know that are going to make it more likely people will have complications from the COVID-19 infection. And so, of course, people who have those conditions, they should put that in context, and they may want to take more precautions than other people would. But that's a good framework. The other thing that's very important for people to remember is there will be things that we recommend now, and there will be other things we will recommend later. So, for example, we have heard people ask, should we cancel public gatherings? At this time, the Tacoma-Pierce County Health Department is not recommending we do that here in Pierce County. However, if things get worse, and if we feel that it will actually prevent the spread of disease, we may recommend that, but not at this time. We may, at some point, tell people you shouldn't go to work and stay home. Well, first of all, we just have to remember not everyone has the opportunity to be able to work at home. Not everyone's got a smartphone, or they don't have that laptop. Or there are many people who keep our society going who cannot stay home. They are the people who take care of us when we need services at the counter somewhere, in the restaurants. They're the ones who are, if there's a power outage, they're out there fixing things. Law enforcement, there's certain people who cannot go home. However, if we are at the stage where we feel that a recommendation for more people to stay at home, we will do that. Closing schools, again, even in King County where there are many more cases, they have clearly said they are not recommending closing schools. We learned from the H1N1 influenza pandemic that did not work. And in fact, it created problems because those kids had to go somewhere. They were taken care of by their grandparents, another child care, or they're at the mall. And it really did not work. However, if at some point we feel that closing schools is going to help and that it's at the stage of the outbreak, then you will be hearing from us that we would recommend that. We have been talking again to our partners. All of them are working on their emergency plans, all working on their continuity of operation plans, and they're also thinking about what tier are we working at. Are we at a low tier, a low level of anxiety and severity, in which case they would implement some changes. Of course, if it went up to the highest tier, we would be recommending those more significant interventions. But at this time, we were expecting we would get a positive case at some time. Today's that day. However, it's not really changing a lot in terms of what we are doing. We're continuing to investigate. We're continuing to do the work that public health does and working with our partners with that. So with that, I'm going to turn it over to our county executive.
Thank you, Dr. Chen. I'm Bruce Meyer, the Pierce County Executive. I understand that people are concerned. I've been out talking with our first responders, with our school leaders, with our elected officials, and I understand that there's a lot of concern in our community broadly. I will tell you that our thoughts and prayers are with the individual, the gentleman who has the infection, has the virus, and we're very thankful that he is getting better. That's a very good thing for us. And I really appreciate the care that is being provided to him by St. Anthony's Hospital. We've been preparing for this for quite some time. The Pierce County Emergency Operations Center has been activated over a week ago. That team and the Tacoma-Pierce County Health Department's incident management team have been working around the clock to make sure that we are prepared for this. We have strong partnerships in this. When we look at our partners at the federal level, at the state level, and at the local level. Just last night, Dr. Chen and I met with the Pierce County and town mayors of the cities in Pierce County and all our towns. Had a great 2-hour meeting with them, is making sure they're prepared. I've been out talking with kind of the Ording and the city of Puyallup today, and I will tell you that they are prepared for this. At the same time, I really appreciate the Vice President Pence coming to Pierce County yesterday. I appreciated his assurance that we're going to get the resources we need, and I particularly appreciate the focus on expanding testing and getting those results much more quickly. That is one of the things that this case showed up. It shows that expanded testing and that quick turnaround of results. I think that's very important for our community to know. As we move forward from here, we're going to lean in heavily on our professionals in public health and emergency management. I am very thankful for their leadership and thankful for both the people in the Pierce County Emergency Management Department and the Tacoma-Pierce County Health Department. We are well served by them. We're going to get through this together. Thank you.
So we're going to introduce some other members of our team for the coming days. We want Jessica Gailey, who's our Deputy Incident Commander currently and will be stepping in this next week as Incident Commander. So she's definitely a person you guys want to get to know. And she is our Environmental Health Division Director. And then Steve Metcalf, who's probably busy zipping off the news release. Steve, come up. No, come on down. I think most of you know Steve, but we do want to introduce him. This is very much potentially a marathon for us here in Pierce County, and we know that we have to have, we have our deepening our benches of support, and Steve, of course, is here at the health department and with me, my kind of deputy, basically, and he will be stepping in as incident. Well, we'll just go ahead and have him be incident commander. He's going to be public information officer in the coming weeks. So, Steve Metcalf, and with that, we'll take questions for 10 minutes. Okay?
Is there any way at this point to know whether or not this was a community transfer or coming from some other source than within the community?
That's a great question. This is a really ongoing investigation. We found out about this just a very few hours ago, and my team of disease investigators have been working very, very quickly to interview the person, and we really appreciate his cooperation from his hospital bed to share information so that we can do the contact investigation, identify people who may have been connected, and then get them the appropriate information and advice. So far, as we shared, there's no indication of international travel, and so far we haven't identified that he traveled outside of the county, but this is early on in the investigation. And I think it's important to stress that this is the first case that we've got, and this is a new piece of information that informs our investigation that's ongoing. You know, this is a picture that's gathering over time that really needs to inform what we do and make sensible decisions for the community.
Was were the symptoms identified by medical professionals treating him for sickness? Is
Sure.
that how this was identified?
Yeah, the person was experienced symptoms consistent with coronavirus. So it's typically shortness of breath, fever, and cough. For a few days before that, they saw their primary care provider and then went to the hospital where they were admitted. And then it was a process of ruling out other things. You know, as this time of year, there's many things that cause respiratory symptoms. The flu is still around, other bugs. So you rule those out, and then they decided to test, and as Executive Dameyer was sharing, this is the good news that now testing's more readily available. The tests were done rapidly, and we have the results to share.
And if you could, I don't know if this was Dr. Chen went into this, when was he tested? Can you tell that?
I don't actually have that information, but the turnaround is much faster than it has been, I believe, in the last day.
Do you know how much time had passed before he came into the hospital and before he was tested?
Yeah, again, this is early in the investigation. We understand he had symptoms for a few days before that.
Did I hear Dr. Chen say that he was diagnosed with pneumonia?
Yes, pneumonia was kind of one of the complications of the symptoms that associated with coronavirus, and you know, that would be conducive with somebody being hospitalized. Mm-hmm.
I'm glad you asked the question earlier, because this is exactly what we want people to do. We don't want people rushing to the emergency room. When people are sick, they do the usual things that they're doing when they have a cold or flu. They, take care of themselves. But when they're sick enough or sicker, we want them to go to their primary care provider. And so he did all the things we would like people to do, that we want to make sure people get the care they need. At the same time, we need to keep the emergency rooms available for people who really need emergencies. Now, he did get sicker, and you may have heard earlier that they did do the other tests like influenza. As Nigel pointed out, very hard to separate these symptoms from the cold or the flu or other respiratory infections. We are fortunate that because University of Washington lab is now up to speed, that we were able to get that turned around quite quickly. So.
Will other family members he was in contact with and had family around, will they be tested?
So again, this is where we would be looking at. If you remember earlier, I said this is what public health does. We do contact investigations. So we would find out what his living situation is, work situation, where he went to. We're looking for other people who could have been exposed, and also where he might have picked up the infection, right? So we're looking at both sides. But this, as Nigel points out, we're early in this. We wanted to make sure people hear the news. However, of course, we haven't gotten all the information yet.
Is anyone currently under quarantine other than that
Just want to clarify, by the way, the patient's not under quarantine, right? So remember, let's clarify, quarantine is when someone has been exposed but has no symptoms, and isolation is when you have the disease, so the person is in isolation. But Nigel, Nigel can explain. There's a whole range of investigations that we do, so.
Yeah, and this is our first case, so the process going forward is to identify contacts of this person, the close contacts, and then work with them to identify what their degree of exposure was, and then they would then be under quarantine. So the process is just starting. And when we say quarantine, it's asking people to stay home for 14 days to monitor for symptoms, and we'll be checking in with them to make sure that they have the resources that they need, and then they know how to contact us.
Right, so there is no one else under quarantine?
Not that I'm aware of.
And was this person living at home? Was he in a nursing home? You said there was an underlying condition.
We're not sharing that information, I'm sure, as you understand, to protect the privacy of the patient in question.
So I understand that there were other patients that were transferred into Pierce County. How many total people have been confirmed COVID-19 patients in Pierce County currently?
Yeah, we don't. I understand that the situation with the transfers into the hospital is a dynamic situation. There's other folks coming in. We don't actually have that total number at this time. It's something we're working with the hospitals on. I refer you to the hospitals as they receive those.
So you guys are saying that you're not recommending canceling public gatherings yet or school closures. Has any of your advice thus far changed now that Pierce County has a case?
I think Dr. Chen put that very well before. This is one piece of information. This is our first case, and we've been expecting this for some time. We've been planning for this. It's one case. This doesn't represent ongoing community transmission. I think we need to monitor the situation carefully, but so we also need to think about the types of interventions that we want to make that make sense now, what people can do now to protect their health, and then what we need to plan for into the future as things change.
So I was wondering, is there a contamination center or anything set up if things get worse?
Contamination. Contamination. In terms of getting people treatment, well, I think it's important to think of this, again, as Dr. Chen said previously, think about the flu. This is something where people need to think about what are the symptoms of this and when they should seek treatment, and then the healthcare system is there for that.
Have plans changed in any way? I know that King County has bought a hotel. Are there any measures like that Pierce County is looking at?
We're working very closely with Pierce County Emergency Management, looking at the options for people who may not be able to stay in their own home, and also working with our State Department of Health, who's working on resources in that direction as well.
Can you talk a little bit more about sort of the advantages of being number 3 in all of this, right? After being in what you've been able to learn from them. Dr. Chen touched on this, but what have you been able to learn from them specifically to help you guys moving forward?
Yeah, I think it's learning more about the virus. We're learning every day about how severe the disease is, as we shared before. This is more like a severe flu. So I think as this goes on, we get a more balanced and reasonable perspective on this, and able to offer advice out to the public about what they can do to protect their health now and into the future.
One or two more questions, and then we'll wrap it up.
Steve, or Steve, whoever's appropriate, will there be updates throughout the
Oh,
weekend
great.
on this?
Thank you so much. So we'll provide information on our website. As we get other cases, we'll just post that information. We won't continue to hold news conferences. If there is relevant information that relates to protecting other people's health, we will share that. But as you've learned about the contact investigation process, we talk to people who are closest to the individual. And if there's not a public exposure type of risk, there's not much more information for us to share. Yeah.
Is there a concern that, we keep hearing this number, 80% will recover, that the number of percentage of fatalities would be quite low. But there have been fatalities, and for people like me personally who has a mother in a nursing home, is there a concern that, we do want people to continue on with their lives. We don't want people to panic, but people may not be paying as close attention to this as they should be and taking the precautions that they should be, because we do need to protect the most vulnerable, right?
You're absolutely right. We want to make sure people are properly taken care of. And I think sometimes, people are worried. I mean, you ask exactly the right question. How much risk can you tolerate, so on. But I just want to assure you that, we plan for a 1918 type flu, right? I mean, when H1N1 hit us 10 years ago, we were planning for a huge pandemic, highly fatal 1918 flu or a bird flu outbreak. So the planning is there. It is not that we are not prepared, that we haven't thought about it. We then have to calibrate that based on what's going on today. And, it's whatever analogy you want to use, tears or a speedometer, our speedometer is kind of down here, right? And if it's up here, it's very different. And if you want to use a driving analogy, exactly, right? When you're just on a side street going 10 miles an hour, it's very different than when you're on a highway going 60 miles an hour. You got to pay attention to everything that's going on at 60 miles an hour. So it's not like we haven't thought about it. And you will see, for example, King County, right? The bulk of their cases have been in the Life Care Center in Kirkland, which absolutely, that's the worst place to get an outbreak, right? You have people who are older, they're maybe immunocompromised, they often have other diseases, you're in a very close congregate setting. That's the worst place to have an outbreak. Actually, if you subtract that out, the numbers in King County are much lower. So King County has issued guidance, but at the same time, they haven't told them to shut down either. They have said you institute these cleaning procedures, you check with the visitors about, are they sick, have they traveled, right? So they're doing screening, and that's appropriate at this time. And I'm sure every long-term care facility, skilled nursing facilities, asking those questions and doing the best practices. What we don't want to do is people to overreact when it doesn't help. A lot of times people think doing anything does something, and that's not true. We want people to do things that worked. You heard me say earlier, these are things we might do, and here's when we might do it. And so we will let our partners and know when we feel like we've moved to that next tier, or we've gone from 10 miles an hour to 30 miles an hour or 50 miles an hour.
Where is Pierce County on that speedometer as opposed to Phoenix County?
12 and a half miles an hour. On the low end, right? Again, we knew this was going to happen. It just happens to be today. Could have been tomorrow, could have been yesterday, but we knew it was going to happen. There's no wall between Pierce County and King County. We know a large percentage of our population goes north every day. In fact, some people may say, well, it's actually surprising it hasn't come earlier, right? So it's very hard for us to say exactly is it 12 and a half miles an hour versus 15 miles an hour, but it's on the low end that we knew was going to happen. Fortunately, it sounds like the patient is doing better, so he's not going to be one of the 10-20% who are going to have severe illness. What we are hoping for, but of course, we prepare for the worst and hope for the best. We're hoping that the longer we see this illness, the more cases we experience, that we will start to see that we saw the sickest in the beginning, and then later on we're probably going to find out that there are a lot of people out there who have very mild, minor illnesses. And so we're keeping our fingers crossed, but of course, we are going to do everything public health always does to protect the public, protect the health. We're going to work with our healthcare partners. We're going to work with our governmental, school, and other partners to make sure that we're doing the best thing that's appropriate for the time.
One more question, and then we're going to wrap it. Got everything? We're good? All right, perfect.
Great.
We agree.
Thank you all for being here.
Yes, thank you very much for being here.
Yep.